This week on The Wheelhouse. Public health meets politics. For Connecticut Public, I'm Frankie Graziano. This is The Wheelhouse. It's the show that connects politics to the people. We got your weekly dose of politics in Connecticut and beyond right here. A few weeks back, former President Donald Trump promised that if elected, he'd cut federal funding for any schools with a vaccine or mask mandate. This promise has come at a time when COVID-19 cases are on the rise, as well as vaccine-preventable illnesses like measles, whooping cough, and Mpox, previously known as monkeypox. It's not the 1960s. That sounds like the 1960s. So today, here in 2024, we're talking about whether politicians like Donald Trump or Robert F. Kennedy Jr. impact how folks are thinking about vaccines. And first, we're going to get into some illnesses popping up in communities across Connecticut and how public health officials are responding and who could you do it with. You couldn't do it with anybody other than Sujata Srinivasan, senior health reporter for Connecticut Public. Sujata, thank you so much for coming on the show this morning.
Good morning, Frankie. Good to be here.
Good to have you. Good to see your radiating face here today. You're very happy. I'm happy. Let's get to business here. 888-720-9677. 888-720-9677. Give us a call today. We've got some epidemiologists standing by to not necessarily, I guess, field questions. I'm sure they can do that as well. But just to be there to provide some context, and obviously Sujata is going to give us some local context as well. You've been reporting on these communities in Connecticut that are seeing a rise in illnesses. One of them, whooping cough. For listeners who aren't familiar, what is whooping cough and what are the symptoms?
Sounds like a whoop. And it's in medical terms called pertussis. It's not good to get it, especially for babies. I don't want anyone to panic here, but science has shown that babies can, because of their compromise, they're yet developing immune systems, yet to develop systems, can react quite severely to this bacterium. Babies could die. Babies could suddenly stop breathing. And that's of concern, given that these cases have been on the rise. And it's been a surge. Last year, there were 11 whooping cough cases in Connecticut, in all of Connecticut. And as of now, according to the latest data from the DPH, the Department of Public Health, there are 131 confirmed cases of pertussis in Connecticut. And the majority of those are among this population, demographic 10 to 19 years of age. And of those 11 years and older, Frankie, only 67% are known to have had a Tdap immunization, that's vaccination against whooping cough, before the onset of their cough. So that's the context.
In the last year or so, when has this spread really become prevalent? You're talking about 11 last year and now 131 or something like that. So when did this really take hold? And is there a situation in the air or anything like that, or a timing of the year or season that really makes this predominant?
Those are all great questions, and there's many in this, so we'll have to unpack it. One is, yes, we've seen a steady rise week to week. So before these 131 probable cases of pertussis were confirmed, that's the latest data, before the prior week, it was 111. So we've seen a steady climb in the weeks. And the concern is now we're going to have kids back in school, and local health officials in our town health departments and epidemiologists are concerned that these kids might not have had, the full vaccine dosage requirements. So that's one part, the
Let's
rise.
go there because, as I made a joke about the 1960s, really this is something I would always see on the vaccination forms with my parents, but we didn't necessarily worry about because I guess we had the vaccine. But when did this start becoming prevalent again? And how old is pertussis and whooping cough? How long have Americans been dealing with that?
Well, the world has been dealing with pertussis documented as as far back as the 16th century in Paris, when there was this outbreak, and it's quite a ghastly kind of a cough where it can damage your bones so badly that people can break a rib, fracture a rib, and it's a very painful cough. So as early as the 16th.
When did we
century.
start knocking it down with a vaccine?
Oh gosh, the first vaccine licensed in the U.S. was 1914, and this has a history of tested for safety. So the first vaccine, the DTaP, came out in 1948, and then it was further made safer in 1996 with the DTaP vaccines licensed with an acellular vaccine, and that addressed febrile seizures, and that was only 1 out of every 1,750 doses in the previous vaccine format. And that's some data that I got from Christine DiPiero-Gasek, who is an epidemiologist at the Central Connecticut Health District.
So I want to ask that because I want to get a sense from 1948, when you have a strengthened vaccine for the first time, to 1996 when they make it better, to now, is it pretty much steadily these cases dropping at that point?
Yes, cases steadily dropped, but then the whooping cough also is a cyclical illness, so it's very complicated. So you have a waxing and a waning phase of the illness itself, and now it's on the rise. Just the nature of the illness, it's back again. But definitely vaccine misinformation and lack of vaccine full coverage, and the doses are very clearly defined by the CDC at what ages. So it starts at a couple of months old, or 2 months, and it goes on all the way till about 12 years. And then adults are also advised to vaccinate against pertussis.
So I think you said earlier, people 10 to 19 years old that are mostly impacted by this?
Yes. In the outbreak, the current 131 cases so far in Connecticut, the majority is the 66% 10 to 19-year-old age group.
So are we assuming then people born in, say, 2014 or 2004, their parents are not getting them vaccinated? Is that one assumption, or is this also taking hold, and you mentioned, in that cyclical way where the disease is sort of evolving?
It's a combination, and I would not... it would not be responsible to make a correlation, but it is based on the feedback from local health department epidemiologists, and based on what we are hearing from the CDC and the Connecticut Department of Health. There is a concern that, and there are concerted efforts to get people vaccinated, which is what the health departments in our state is doing. Sans Cleary, director of the Fairfield Health Department, talks about Darien, Norwalk, Westport, Weston, Easton, Fairfield, Trumbull, and Stratford joining together this year to launch the Get Vaccinated Connecticut campaign. And that's to address vaccine hesitancy. They have a new website, they have Facebook, they have promos, trained platforms and posters and billboards and so forth, seeking to address concerns. And also the Central Connecticut Health District has other programs that, to target vaccine hesitancy, including what they call a cocooning program. It's not yet launched. It's about to launch now. They're working to get caregivers up to date with their pertussis vaccine, and that's to protect infants from serious illnesses. So, in daycare centers and so forth, if your adult caregiver is not vaccinated, that obviously puts this baby at risk. So that's something that this health department is doing, and other health departments across Connecticut as well.
What illnesses might you be seeing out there in the community? Give us a call, 888-720-9677. Maybe you're skeptic of a vaccine or something like that. We don't necessarily need to know what you think is in the vaccine, but maybe your concerns. Give us a call, 888-720-9677. Sujata, help us understand, besides pertussis, what else is prominent in the community right now?
Well, we've been concerned about measles for a while. That's across the United States, and because people travel and travel to internationally and domestically, that's of concern. And in the US in 2023, according to the CDC, there were 58 measles cases. But as of August 23rd, the latest data, we have 227 cases. And globally, it's up 80% for 2023. That's last year from the previous year. And Johns Hopkins attributes this partially to a significant decrease in measles immunization. And that's we've had some disruptions during COVID time where people held back due to justifiable concerns, especially before the COVID vaccines were out, going into medical settings to get vaccinated. So more than 61 million doses of vaccines were postponed or missed globally between the 2020 and 22 COVID disruptions.
What about Mpox?
Mpox is currently being watched by health officials, but it is not blown up into a significant health concern, although one can never rule out communicable disease. We have 13 Mpox cases so far in Connecticut. Thankfully, knock on wood, no deaths, Mpox associated or pertussis associated in Connecticut so far. Knock on wood, like I said. Again, there is concern that people are under-vaccinated. So as of Jan this year, the CDC estimates that only 1 in 3 people in Connecticut who are at risk were vaccinated against Mpox.
You have to see the amazing work that Sujata is doing to get this information to you right now. An oracle of information and some great notes that's being shared right now. All right, let's break this down a little bit. Let's reset a little bit. So we got 131 or so cases in Connecticut of pertussis.
Yes.
And then we have about 13 of Mpox.
Correct.
How many do we have, do you understand, of measles? Do we have any cases?
At the moment, at the last count, no, but we do have in Massachusetts, we do have in New England states.
Okay.
But we've got to keep an eye on it, and it doesn't mean, that the MMR vaccines have been effective, but measles cases are spreading nationally.
Yeah, and you have to have a big concern about the MMR vaccines because that's something that people that are vaccine skeptic don't necessarily like to take. So that could be a very big concern with the spread of measles.
Well, the starting point, Frankie, and this is where we should all, I believe, and it's important for us to understand and approach this with empathy. People who are against vaccines, we have to accept, the common ground, meet at the common ground that all parents want to do good by their child. And fear is not always rational, and it's not something that only others have. We all have some type of fear that we know is not rational. And, if human beings were perfectly rational, it would be a different kind of society. But then we do have our fears. And that's where, the vaccine fear comes from, that there is a genuine belief that the ingredients in the vaccine could damage their children. And when you approach that, whether you're a journalist, whether you are an epidemiologist, whether you're a policymaker, a physician, a community health worker, you approach with respect and empathy. What is driving this fear? And that's the first starting point. And then you respectfully offer an alternate. Hey, I have this information. Do I have permission from you to send it to you?
I appreciate that take because just breaking this down with you and seeing the numbers, there is at least a pronounced spread of some of these illnesses. We're not necessarily seeing it with the measles, but as you outlined, with people 10 to 19 being at least in this space where they could really get sick from the first illness that we were mentioning there. I'm losing my mind today, Sujata. I apologize. From the pertussis, it seems like it is very important to at least get vaccinated or consult your doctor about getting vaccinated.
Correct. So the first source of trustful information is one's pediatrician and primary care provider. And if there is any concern about a vaccine reaction, the physician will go over that with the parent and talk about potential alternatives. So yes, it's the primary care provider, and then many towns, including the Central Connecticut Health District, they do have a person available to respond to concerns, respond to misinformation, set right misinformation. And there are hospital networks, the Children's Hospital of Philadelphia. I mean, they're tremendous, trustworthy sources on the web.
Connecticut's management of infectious diseases under the microscope a little bit this past year, as we saw SCOTUS could have potentially heard a case, a 2021 CT ruling repealing the religious vaccine exemption, SCOTUS not hearing it. So that was something that was at least a big deal. Some folks that are against the vaccine and wanted this to be repealed were upset about that. But nonetheless, this continues to be in practice in Connecticut where the religious exemption is repealed.
Yes, Frankie, and let's not forget that in 1855, Puritan Massachusetts,
Take me there.
Was the first state in the United States in 1855 required children to get immunized against the newly developed smallpox vaccine before going to school to prevent the spread of smallpox in schools. So, we've got to remember that our founding fathers did keep religion and state separate in the Constitution.
Forever, the government has wanted this to be the case. So this is not a new thing. When people, as Brian Festa, who's one of the individuals that was very concerned about the Connecticut exemption being repealed. He is a co-founder and vice president of this group called We the Patriots USA. It's a nonprofit group actually located outside Connecticut. They say they use litigation to protect religious freedom and health freedom. They're saying something like, if you keep having rulings like this, what it does is it sets the precedent that you're not allowed to refuse things for any reasons, personal reasons, religious reasons. State mandates something, put something in your body, you have to do it. It hasn't been the case that governments have always been looking at this as if we're forcing you to put something in your body.
There is a historical mistrust of government, especially by some communities. I'm going to start with that, Frankie, because I'm not going to completely debunk this gentleman's statement, because like I said, no matter, we've got to listen and we've got to respond with facts. The CDC, at a very inglorious moment of our history in the 1930s, did push stuff into black men's bodies. They actually injected syphilis in the infamous Tuskegee experiment, right up until the 70s, well after penicillin was proven to counter syphilis. And these poor men who not only were injected with syphilis, those infected with syphilis were not given penicillin because the researchers wanted to study how the disease progressed in the human body. So there is that historical mistrust, but this came to light, the media brought it to light, and we've got to create systems in place for checks and balances, that no power goes unchecked, whether it's a pharma company, whether it's a government, whether it's lobbying by any group. And that's why we exist. And then we are kept in check by the public. So we are answerable.
William Tong, the Attorney General of the Connecticut, said that this essentially shows that our ruling stands up. And that I guess you can infer from there that the checks and balances are in place in Connecticut. Sujata Srinivasan, thank you so much, senior health reporter from Connecticut Public. Sujata is going to stay here and walk us through the dangers of politicizing vaccinations. Also be joined by global health reporter Dylan Scott from Vox. Dylan's got the scoop on how politicians are talking about public health on the campaign trail. And man, are we turning this into a powerhouse sort of health and public policy panel here with Greg Gonzalez, associate professor at Yale School of Public Health. He's going to help us understand how medical experts are responding to the vaccine crisis of confidence. Join the conversation, 888-720-9677, 888-720-9677. This is The Wheelhouse from Connecticut Public. I'm Frankie Graziano. Today's show is all about what happens when public health and politics collide. We're breaking down the anti-vaccination rhetoric expressed by some politicians on the campaign trail And we're talking about the impact that rhetoric has on communities here in Connecticut and beyond. Still with me, Sujata Srinivasan, senior health reporter for Connecticut Public, who's just done a terrific job breaking down where things stand in Connecticut on some of these infectious diseases. And joining us now, Dylan Scott, senior correspondent and editor covering global health for Vox. Dylan, welcome to the Wheelhouse.
Thanks for having me.
Thank you for coming on. And Greg Gonsalves, associate professor at Yale School of Public Health. Greg, thank you so much for being on here this morning.
Thanks for having me as well.
All right. First of all, Greg, a little curveball at you here. We had a caller. It's Maria from Glastonbury. You want to make a comment? Go ahead, Maria.
Yes, good morning, and thank you for taking my call. I am 80 years old, and I've been having all the vaccines for COVID, plus shingles and whatever the doctor recommend me. It's a common sense because if you have family, you want to be okay for them. And I use my mask wherever I go, so I don't understand why they had to politicize the point of the vaccines, especially that guy Kennedy talking about against the vaccines.
Maria, it sounds like no matter what you believe, it sounds like you really care about other people, especially your family, right?
Especially my family and my neighbors and my friends. It's common sense. You don't want to be sick. I'm being free of COVID, free of flu, because I take care of myself. I wish that all the people think that way. And thank you for taking my call.
Hey, thank you for coming on. If I pop in and if we see maybe Maria in Glastonbury, I know that that's somebody I could potentially ask for a hug or something like that, because Maria's not going to get me sick, it sounds like. But Greg, I'm sure you echo those sentiments that it's probably important to get vaccinated, if for nothing else than to protect your loved ones.
Well, Maria is a perfect public health messenger. Everything she said was, right on target. So we got to get her own public health show. Mm-hmm. We need to get back. We need to get our COVID boosters, right? They just made available after approval by CDC. But as Sujata is describing, we have outbreaks of childhood preventable diseases, not just in Connecticut, but all across the country, which are absolutely preventable if we have enough people in our communities vaccinated against these infections.
This is my favorite question to ask you all the time. When do we get the booster?
It's up to you. I mean, the point is, if you haven't been boosted in a while, probably you should think about getting it as we move into our winter respiratory virus season and get vaccinated both against flu and COVID. I can't tell you when to do it. They're available now. If you haven't been boosted in a while, probably the imperative is to do it sooner rather than later. If you've had a booster in the past 6 months, maybe you're waiting a little bit longer into the fall. But you should get vaccinated no matter what, particularly if you're at high risk, elderly, immunocompromised, have underlying chronic conditions.
Is anybody can answer this? Sujata, you can too. What's the deal here with vaccinations for COVID boosters? We haven't really talked about the spread of COVID being up, but it is. Is it available to everybody if they need it?
Oh, yes. People should start, as we just heard from Greg. I mean, people should start getting vaccinated for COVID. And the Moderna, I'm actually going to be talking to one of the vice presidents of Moderna this afternoon about their updated booster for the new circulating strain. And, people working, in healthcare environments, people who are immunocompromised, people who are caregivers of people who are immunocompromised, undergoing chemotherapy, elderly people, people around babies with developing immune systems. I mean, these are all mainstream science from the CDC, from your local doctor, your local epidemiologist, published data that say get vaccinated so you protect yourself and others.
I talked about the MMR vaccine earlier. Greg, you can answer this too. Dylan, feel free to jump in if you want. But I talked into this about this earlier because a lot of people might scoff at this because this has been such a concern of a lot of people that I've heard out in the field when I go and interview people. They think that if you get the MMR vaccine, that you could potentially somehow make your child on the autism spectrum. And it's not lost on me as a parent of somebody who has autism that now you can somewhat feel responsible because you have so many people out there that are saying, hey, you get that vaccine, you've now given your child autism somehow. So can you help us understand, first of all, that this doesn't necessarily give your child autism or put them on a spectrum? And please stress the importance of vaccines if you can and why parents might want to get them.
Well, first of all, Frankie, you are an incredible dad. I mean, that kid of yours, both your kids, but that your child with autism is a bright spark, and he's a delight. I've interacted with him, and it's you and Colleen are doing an amazing job as parents, and he's shaping up beautifully. You know, this is the problem with misinformation, and especially when it comes from a perceived source that is trusted. It all originated in the early 90s, late 90s, in a journal in The Lancet that was retracted in 2010. Its author, Andrew Wakefield, had his medical license in the UK stripped, after an investigation found that he had perpetrated an elaborate medical fraud, misinformation by the British Medical Journal. So this was debunked in 2010, but it's circulating, and we go back to fear, parents experiencing fear. One parent says, I gave my kid's vaccine, I gave my baby a vaccine, but then he got autism. He was perfectly fine before that. I know, I'm a parent, I saw. Now, it's very difficult to counter that kind of strong emotion. And the only way to do it is with respect, with empathy, and with medical science. Because science is not political. It's being politicalized. It's a tool that's being politicalized as any other tool. And then, most unfortunately, President Trump has repeated claims, as far back as, his debates in the Republican primary in 2015, talks about some employee that he claims whose child developed autism after being vaccinated. And, the alignment with Robert Kennedy Jr. and, other people who are against vaccines has not helped counter this misinformation and this fraud that was perpetrated by Wakefield.
Greg, go ahead. In your medical expertise, what would you say to parents who are nervous about some of the routine childhood vaccines that fight against things like measles, mumps, and polio?
Vaccines are remarkably safe, right? This is supported by data all across the board. You do not, my father had polio when he was a child. There was no vaccine against it, and it changed his entire life, right? We don't need to fear infectious diseases because we have the tools to prevent them in many cases, right? We need to be able to as Sujata said, meet people where they're at, help understand their fears, but we cannot be in a situation where we see dozens and dozens of whooping cough cases in Connecticut, where we see measles outbreaks in Oregon and other places on the West Coast. Mm-hmm. We're putting children's lives at risk, and decisions you make for your own child based on misinformation are going to affect children all across the board. Because remember, there are diseases like measles in which, unless you have a significant number of people around you vaccinated, you don't have herd immunity. So we need decisions you make for yourself are also going to affect people around you, children in your own children's school, etc. So vaccines are remarkably safe. The infectious diseases they prevent are remarkably dangerous.
That's the thing. I mean, words are important, and you're not full of bluster as I am often, and I come off so many times. So when you say something, I really listen. You said twice that vaccines are, and the key word was remarkably safe. So that is something that I think carries a lot of weight when you say it, Greg. Now I want to get into how politics come into play. Dylan, here's a little clip from a recent speech former President Donald Trump gave at an event organized by the Conservative Christian Faith and Freedom Coalition.
On day one, I will sign a new executive order to cut federal funding for any school pushing critical race theory, transgender insanity, and other inappropriate racial, sexual, or political content onto the lives of our children. We're not going to do it. I will not give one penny to any school that has a vaccine mandate or a mask mandate.
Dylan, he's going to do a lot there. Can you provide context and unpack it a little bit, and obviously get us to where we're talking about the vaccine mandate, the mask mandate, and some of the other things that people are concerned about there?
Sure. I mean, to follow on your point that you all were just making about attitudes and the misinformation that's been allowed to fester, I think the challenge that we're up against is the public health vaccination campaigns. The public health campaign has been losing ground. In 2001, basically 2/3 of Americans said that it was important for people to get their childhood vaccinations. And now that number is down to 40%. And so that's a pretty striking decline in the course of just a couple of decades. And that's the challenge that we're up against. And I think that, what sticks out to me about President Trump's comments is that, obviously vaccine hesitancy has been around for a long time. I think what's different is it has been edging closer and closer to the mainstream. And that's certainly been pushed by figures like RFK Jr., who's been at this for a while and really dedicated a lot of his public work to it, and elevating the platform of people like Andrew Wakefield. But it's also, it's gotten some cachet from celebrities up to and including somebody like Donald Trump. And so I think that's it's no longer like a fringe view. It's a view that the former president of the United States expresses from the campaign stump. And so I think that the influence of those, like that kind of giving that kind of validation to vaccine skepticism, I think that's the real concern here. Because the other thing that stuck out to me about what Trump said is he's lumping vaccine mandates together with masks and with critical race theory, these sort of things that, especially in the case of masks and vaccines since the pandemic, have kind of all been, tied together in this culture war, this, the people versus the elites kind of framing that Republicans like to campaign on. And so, that's where I think that is what stuck out to me about what Trump said, because ultimately, this is a toothless threat. I spoke with some education policy experts in Washington, D.C. The federal government does not really provide a lot of funding for public education in this country, actually. It only provides about 10%. The rest comes from state and local governments. And the federal funding that is available, there's very clear stipulations about how that money needs to be spent. So the experts that I spoke to were not really worried about Trump actually cutting off funding to public schools because they have vaccine mandates, which, to be clear, almost every public school in the United States does have already. So he's basically threatening to cut off funding to every school in the country. But they weren't really worried about that. They were more worried about this soft influence and the way that comments like this continue to lend legitimacy to vaccine hesitant attitudes.
Soft influence. I like that phrase. I'm going to keep that in the back pocket here as we continue to report on not just vaccine skepticism, but obviously the epidemiology of the spread of diseases. Even if it doesn't seem like former President Donald Trump could carry out this defunding plan, I think you would say that it still warrants taking these comments seriously. There's still some impact.
Absolutely. I mean, we saw for both good and ill the way that somebody with the platform that President Trump has, the way they can shape people's vaccine attitudes and their actual behaviors. He had I would describe it as a complicated relationship with COVID vaccines. Mm-hmm. His administration did play an important role in helping speed along their development. And he did sort of officially say that people should get vaccinated. But at the same time, he was, kind of indulging the vaccine skepticism that was prevalent within his political movement. There have been other studies that have shown that just being a Trump voter was associated with a lower likelihood of getting vaccinated. A different survey from Pew found that the people who trusted Trump the most for pandemic information were at the same time the people least likely to be vaccinated. So I think there's a lot of evidence to suggest, if you look at it in the aggregate, the Trump voting parts of the United States did see more deaths when adjusted for population during the pandemic than other parts of the country. So I think there's a lot of evidence that kind of your political beliefs, your relationship again, kind of to institutions, to expert consensus, things like that, things that Trump has really tried to undermine as a part of his political career, like that does a lot to determine your likelihood of whether or not you will get vaccinated. And so, yeah, he's continuing to fuel this fire. And I think that's, again, where his that influence and that impact of his words is what's worrisome.
888-720-9677. Call us if you have any questions or concerns about things that are spreading around in your community. Greg, I got to ask you, because we're talking about there might not necessarily be a threat of defunding, but you also have a lot of folks that are outspoken out there like yourself that are trying to make sure that you're informing people. Is there any way that this sort of soft influence can kind of get to academia? Can it get to some of these important organizations in the country that deal with this? Go ahead, Greg.
So let's be clear. Both President Trump, Robert F. Kennedy Jr., people like Ron DeSantis, and his Surgeon General, Joe Ladapo, are spreading misinformation and quackery. Full stop, right? Dylan was saying this is moving towards the mainstream. It's not moving towards the mainstream. It's being pushed and mainlined into the American discourse, which has no basis in science, right? And so public health experts and public health officials have very little power and often have very little resources to compete with the megaphone that Donald Trump has on the campaign trail. The point is, as Dylan said, this is not only about vaccine hesitancy and differences in uptake. Researchers from the Yale School of Public Health, Jacob Wallace, Jason Schwartz, Paul Goldsmith-Pinkham, showed that excess deaths in Florida and Ohio track with partisan affiliation. So Donald Trump is leading his own supporters into a dangerous ground that imperils their own health. And as Dylan and others have said, these attacks on COVID vaccines are now leaking into vaccine-preventable childhood disease and imperiling the lives of our children from coast to coast. One other thing to say is that this is not a red state versus blue state question when it comes to vaccine-preventable diseases. There are plenty of pockets of liberal Americans. I'm out here in the San Francisco Bay Area, for instance, who have pushed against childhood vaccine mandates in their own communities. So there's some sort of bipartisan skepticism about vaccines, which has no basis in science. We have to be careful to say that it's only coming from the GOP. It's also sort of coming from sort of very progressive enclaves in the West Coast and other places.
Mm. Yeah, I mean, adding to what Greg and Dylan said, unfortunately, much as we would like it to be, COVID is not the last pandemic. And the question is, how will the next administration and the administrations to come shape public health response? And what have we learned from the COVID pandemic in our public health messaging? See, the day after President Trump made the comment, it was a speculation. It was not even an advice. It was a speculation. It was just things that we think out aloud in private, perhaps. But the president made a public speculation in front of the media during a briefing about potentially injecting bleach as a way to address COVID. And the very next day, the Maryland Emergency Management Agency released a statement warning people, please do not inject bleach or other disinfectants into your body. It will not protect you from the virus. The makers of Lysol and cleaning products had to put out their own statements because the then Maryland governor said they had more than 100 calls about this particular method mentioned by the president. So his words carry weight. Words carry power from the President of the United States. How will that be utilized in shaping public health messaging in the years to come?
And this is what Greg underscored. He said it's starting to imperil vaccine-preventable illnesses among children and really starting to imperil children. So you have that vulnerable population plus people of color who have been traditionally the subject of medical experiments, and they've really been hesitant of vaccines. Not all of them, but some of them because of this. So help me understand now as we finish up this segment, help us understand what this kind of language is doing to these communities, children and people of color.
It's language. I mean, words are incredibly powerful. They are the vehicle of trust between people in power, people in authority. And when you are told that something is right, I mean, there are people who will believe it. And it's as simple as that. I mean, it's easy to say, get news from trustworthy sources or, avoid misinformation, but it's a lot more complex than that. And the way to avoid it is counter with, campaigns against misinformation, responsible journalism, responsible public health messaging, and responsible voting.
Dylan, Greg, you could get like 8 to 10 seconds. We don't have that much time. Can you just jump in and address this if you need to?
We're coming up on the beginning of the school year. Ask your school principals, ask your school superintendents about vaccination levels in your own schools. Even if you vaccinate your own kids, what's happening around you in schools is going to affect your kids' lives and well-being. So ask your school principals and your school superintendents, how many of our kids are unvaccinated in this district? It's a matter of life and death.
From Connecticut Public, this is The Wheelhouse. I'm Frankie Graziano. We're heading to break. We still got Sujata. We're going to say goodbye to Sujata, but we're going to have Dylan Scott with us still, and we're going to have Greg Gonsalves. Keep listening to The Wheelhouse, 888-720-9677. This is The Wheelhouse for Connecticut Public Radio. I'm Frankie Graziano. Today we're exploring that place where politics and public health meet. Let's talk about the future, the fall coming up, and hopefully there won't be as predominant of a spread as there seems that there could be this fall of some illnesses. Dylan Scott, senior correspondent and editor covering global health for Vox, is with us. Greg Gonsalves, associate professor at Yale School of Public Health. 888-720-9677 if you want to call, but do be quick. Just want to ask you, Greg, any concern amongst public health experts regarding another pandemic in the future?
Well, one thing we can be certain of, there will be another pandemic in our future. What we've seen over the summer and heading into the fall is that the specter of H5N1 influenza and Mpox, which is spreading rapidly in Central Africa, are potential hazards that we may face. But it's also shown that we're really not prepared for what's next to come. The epidemic and outbreak in Central Africa for Mpox has sort of roiled through the continent for over a year. H5N1 is spreading in our livestock herds, yet we've sort of underinvested and underreacted to this threat. Neither of them are an imminent threat to Americans, but we really have let down our guard in a way that seems incomprehensible after the worst pandemic in over a century.
Tell me a little bit more about H1N1.
Well, it's infected many dairy herds across the country. We've seen a couple of cases, a handful of cases.
Bird flu? Is this bird flu?
This is bird flu.
Yeah.
In livestock workers, it hasn't made the jump to human transmission, but we don't want H5N1 bird flu seeding our dairy herds across the country, making leaps into other animal species and making a long-term foothold in the U.S. Yet we've had very little sort of concerted effort in at the state level, the local level, and the federal level in dealing with this. And you've seen op-eds in the Journal, the New York Times, and other places saying, "What's going on? How can we be coming through the worst pandemic in a century and watching this other one sort of burble through our cattle herds and doing very little to combat it?"
Well, can you just give me a little personal perspective there, Greg? I mean, you spent so much time. I called you up so many times during the pandemic. You've been trying to inform us about all this stuff, but clearly there's a strong segment of our population that is not listening. How do you continue to do your work when that happens?
It's the job. It's the job of public health officials to sort of keep at it, even when people don't feel an imminent threat to themselves. Remember, most of the public health work is done in the shadows, right? When something goes wrong, that's when you know something's afoot. But public health officials, local, state, want to keep you safe every day, whether it's clean water, safe food, or childhood vaccinations. Public health officials are working tirelessly across the country to keep us safe. But it's only when things go completely bonkers do we see anybody pay attention to what's happening to public health in this country. Bird flu, Mpox, even childhood preventable diseases aren't getting enough attention because people have an attitude out of sight, out of mind. If it's not affecting me right now directly, I'm not going to worry about it.
Hey, Dylan, what the heck is the pandemic paradox?
I was, it's a concept I was thinking about and that came up in some of my own interviews when I was trying to figure out sort of like what more could we be doing with H5N1 and why does it seem like we're kind of struggling, to Greg's point, to marshal a response. And basically the idea was, I think it's important to remember that like actually preventing a pandemic from happening in the first place is really hard because like nature is a very creative force and is really good at working around our biological defenses. And, it's sort of an inevitable fact that a new pandemic will require this, leap in evolution or some kind of unexpected mutation that is what, allows a pathogen to start spreading among people. And H5N1 is kind of in that staging area right now where, it's starting to circulate among mammals that are more closely related to us, and that increases fears that it could soon adapt to spread effectively among people, but it's not quite there yet. And so like that's where we're in this challenging period where I think undoubtedly more could be done to be monitoring the threat, to be testing animals and testing farm workers, potentially vaccinating both populations as well. But at the same time, like you maybe don't want to like turn over all the seasonal flu vaccine factories and start pumping out H5N1 vaccines when we don't know exactly kind of what version of the virus we would be facing in a pandemic scenario. But no, that's what that's sort of just a concept that snapped into focus for me as I was reporting this out. But at the same time, like I do want to just kind of emphasize that like we could still try to be as prepared as possible, and we're clearly not doing that. And I think, we've both in terms of the somewhat anemic response from the US government to the H5N1 threat, to the failure of the pandemic treaty talks at the World Health Assembly a few months ago, like there is unfortunately a lot of evidence that like in spite of everything that we lived through during the pandemic, despite the urgency that I think people felt a couple of years ago to try to make sure that such a situation never happened again, complacency is starting to set in, and sort of old parochial concerns are starting to override, like the fact that we're all in this together and collectively are going to have to respond to future public health emergencies. And that's made it really hard to maintain the momentum that was there a couple of years ago.
Only about 15 to 30 seconds left here, Greg. You said earlier the physicals are coming. You talked about parents talking to their supers about vaccines. What else should parents and children be doing right now?
Just make sure your kids are up to date with vaccines, vaccine-preventable diseases that are usually given, plus COVID vaccines. We want to protect our children. We want to protect our families, as Maria started off the show talking about. It's just common sense, right? We don't want to get sick. We don't want to make our families or friends sick. So get vaccinated. Talk to your friends and family, make sure they're vaccinated, and make sure your schools are safe.
Speaking of back to school, I hear that Dylan, your child is starting kindergarten. Congratulations to your child. Thank you for joining us today, Dylan Scott from Vox. And of course, Greg Gonzalez joining us all the way out from California today from Yale. Thank you so much, Greg.
Thanks so much.
Happy birthday and congratulations on becoming a full-time employee at Connecticut Public to Chloe Wynn, a good friend of mine and my partner in bringing the politics to the people. Show edited today by Robin Doyen Aiken, technical producer, the maestro Dylan Reyes. Thanks to Tess Terrible for helping us in studio, Meg Dalton overseeing the production of The Wheelhouse. Also a lot of support from Megan Fitzgerald for the show. Download The Wheelhouse anytime on your favorite podcast app. I'm Frankie Graziano. This is The Wheelhouse.